Members, that will take us to item number 6, which is a briefing on consultant spending audit. Thank you all.
All right, just scooting over one seat. Let's see. My name is Keith Salas. I am an assistant city auditor for the Office of the City Auditor, and I was the manager who oversaw this project. Thank you for giving me the time to talk to you about this, and I will try to be speedy with it. All right, so the objective of this audit was to determine whether the city is effectively and efficiently managing consulting contracts. The reason that we focused on consultants is that we spend a lot of money as a city on consultants each year, roughly $93 million annually over the past 3 fiscal years, 23, 4, and 5. Consultant spending is broken up into 2 categories. We have general services and professional services. Professional services are things like architects and engineers, and they're a very small fraction of our overall consultant spending. The vast majority, about 95%, are general services. That includes management consultants, IT consultants, things along those lines. We focused our efforts on looking at those general services. And these services are used by virtually all departments across the city. What we found is that the city may not be able to show why consultant services were needed or how they were used. The way we came to this conclusion is we looked at a sample of contracts, 28 in total, and we found that about a third of them lacked a written needs assessment. So that was a clear explanation of why it was that we were hiring these consultants. And then over 4/5 of them did not have a formal evaluation showing why the work could not be done by city staff. Sometimes that may be obvious, if we're hiring an IT consultant and there's only a couple people in the world or in the country who can do this work, we're not going to have that in-house. Other times, like if we're hiring inspectors as consultants, well, we have inspectors as city employees too, and we might want to see that evaluation to make sure that we're using our funds effectively. We also looked at deliverables. We found that in 4 of our contracts, staff could not show support that they had received all of the deliverables they required. In one of the contracts we looked at, we found that the scope of work was missing. It was something that was referenced in the contract itself, but it wasn't there and staff couldn't provide it to us. So we weren't able to determine whether or not, we weren't able to know exactly what those deliverables are, and so obviously we couldn't determine whether or not we'd received them. And then in 2 other contracts, the contract manager, the original one had left the city. The new people who were overseeing these contracts weren't really familiar with them and couldn't tell us where the documentation was, where the deliverables were, just basic questions like that. In terms of the deliverables themselves, we generally ask that our deliverables are measurable, are specific, and are time-bound. We found that about 16% of the deliverables did not meet those. So we saw things like assistant monthly committee meetings, assistant onboarding, assistant financing, assistant development, and what exactly that looks like could be up for interpretation. So in order to be able to make sure that we're getting exactly what it is that we need from our consultants, we ask that they have those, specific, measurable, time-bound components. Our second finding is that we don't consistently evaluate the performance of our consultants. So for almost 2/3 of them, we did not have a formal performance appraisal. This is not something that's required, but it is best practice. And then again, we had those 2 contracts where the new contract managers just weren't even sure if they'd done that or not. Even when we do an evaluation, we don't always get an accurate assessment. The way that we came to this conclusion is that we reached out to the contract managers and asked them, did you receive everything that you asked for? Was it on time? Those kind of basic questions. In one of these, and this was not the only one, but it's, I think, a good example, they came back and said they'd received some, not all of the deliverables. The situation was that the contractor was unable to find a subcontractor to do some surveys, so we cut the contract short. We didn't pay them the full amount. That's all going according to our normal policies and procedures. But when they actually did the closeout, you can see here that first question, were all services provided? Well, they said yes. We know based on our discussion that that's not true. They said that it was not applicable whether or not the termination had been early. Well, we know that it had been. And the reason this is important is that this consultant may come back looking for future contracts, and we'd want to know that they weren't able to do this to help make sure that we're not in the same situation in the future. Our last finding was an additional observation. This was something we noticed in one of the contracts for over $240,000. The consultant's name in the headline was not the same as the consultant's name in the body. And again, it's hard to hold people accountable when we have the wrong name. So our recommendations are that we provide clear guidance to departments on how to conduct needs assessments, that we work with the city manager to make sure that deliverables are maintained along with other essential documentation, and that we require performance evaluations and lessons learned for all consultant contracts and use them in future hiring decisions. So with that, I'll take any questions you have.
Great, thank you. Why don't we ask y'all to comment, and then we'll open it up for questions.
Good morning, Chair Watson, members of the chair, excuse me, members of the committee. Sorry, I haven't had enough coffee yet.
That's all right.
James Scarborough, Austin Financial Services Chief Procurement Officer. I have with me Director Olivares, and we are happy to respond to the review and feedback of our colleagues at OCA concerning consulting services contracts. Specifically, we acknowledge the need for improvement with regard to the needs assessment. We do provide guidance to the departments with regards to reviewing their need for professional services, consulting services specifically, and to document those needs. But to the extent that they're documenting them in a consistent way and that they are retaining them in the file and that somebody, including ourselves, are checking them in the file, then we think we can do a little bit better there. With regards to performance evaluation, we have been evaluating our professional services consulting contracts for design and engineering services for a number of years. We use a standard evaluation criteria, and we aggregate those evaluation findings over multiple contracts to determine future evaluation ratings for those consultants when they apply for design projects in the future. That has worked out very well, but we just have not expanded that into general procurement. As my colleague referenced, this review was of general services consulting contracts, and so this would be an ideal time for us to kind of take advantage of that window and go ahead and expand our contractor performance evaluation beyond the design and engineering space and into general procurement as well. So we've started working on that last couple of months, and we hope to implement towards the end of the fiscal year. Otherwise, we are satisfied with the depth of the review and look forward to implementing the recommendations and further improvements in how the city documents and records consulting contracts.
Great.
And Kim Olivares, Director of Financial Services. I also want to express my appreciation to the City Auditor's Office for the work on this audit. This ties in really well to the evaluation that's taking place around all of our various shared services in partnership with the Budget and Organizational Excellence team. And so one of the other things that we committed to is working with BOE on evaluating just consultant utilization in general relative to city staff capacity, capability, things like that. Also, as we look at, as part of that shared services evaluation, I think the contract management titles and roles is part of that. So I think this really helps us address potential efficiencies and opportunities there, because the vast majority of contract management roles are within the departments as opposed to within financial services, but we do set standards and the sort. So we want to make sure that we're providing the best standards, guidance, information for all those folks throughout the organization. So again, appreciate it.
Great. Councilmember Alter.
I was wondering if you could help me understand something that I've seen a number of times over the past number of years. We'll get a contract on the agenda and it'll say, you know, $5 million for such and such consulting contract, or it could be a different kind of procurement. In year one, we only have $3 million in the budget. And so there's this gap between what we have and what we're authorizing. And the reason I'm asking that question is it gives me a little concern that, especially in the consulting space, we might approve a very large consulting contract with, you know, pick your consultant, and then in the backup, it says, well, if you don't do this, you're not going to be able to analyze, whatever critical service. But then 3 months down the road, there's a need for some kind of consulting service. And you say, oh, well, I've got $2 million worth of space in that consulting contract that was just approved. So I don't need to go back to council because I've got that authority. That gives me a little concern, and I'm curious why we do it the way we do it, and if there is a way for a better check on that kind of open spending.
So one of the reasons why you'll only see that funding in the amount of X dollars is available in the current fiscal year, and then it's dependent on future budgets is, and this is where I'm going to pretend I'm an attorney, there are limitations on binding future councils to various expenditures. So it may be intended to be a multi-year contract, and therefore the dollars will be expended over 2-3 fiscal years, so we can only speak to that first fiscal year specifically. When it comes to overall authority of a contract and perhaps being able to use some of it for various needs, there's going to be unique situations for each contract, so it's hard for me to kind of speak to that in general, but regardless, each contract, there was a very specific scope of work that was utilized for the solicitation and ultimately the agreement with the consultant. So regardless, any work done under that has to still fall within that scope of work. Because it would trigger all kinds of other issues if it were not. So if there's any certain examples that you're thinking of, I'd love to discuss that with you to make sure that we're either providing better clarity with the council action or just a clarity with the departments on how they're utilizing these contracts going forward.
Okay, thank you.
Thank you. Yes, Councilmember Siegel.
Thank you, Mayor. I just had a quick question on our total spend on consultants. The audit report has an Exhibit A that I think earlier in the report it says it's both professional and general consulting, but I'm not clear on that. So the $100 million, $102 million for fiscal year 2025, is that general consulting or general plus professional? I guess this is for financial services.
Oh,
okay.
yeah, I believe that was both. We only looked for the sake of our samples at the general services, but that was the vast majority of, I believe, 95% roughly of the spending fell under that category.
So does this not include, for example, public health contracts?
Well, if it's labeled as a consulting contract, then it would be included in that, yes.
The public health contracts you're referring to, the social services contracts, those are handled vastly different than what we're looking at here with the general and professional services, so that they would not be included in here.
Okay, so yeah, so there are types of contracts for outside parties that are not considered consulting contracts?
Yes, those social services agreements would not be handled the same way here.
What would be the terminology for those?
That's where because those, and I don't want to dip my toes too deep into the water that I shouldn't be dipping in then too. The social services, they're referred to as contracts, but they're social services agreements where there's often they're providing services on behalf of the city as opposed to us receiving the consulting services. Public health handles those. They don't go through the same kind of solicitation process that for our general professional services contracting. But I think as there's the conversations about social services agreements, and I call them agreements on purpose because the term contract has very specific implications. So those social service agreements, I think as those conversations continue about those along with the budget process, we can dig into that.
Service provision versus consultation and advice.
Yes.
Okay, thank you, Mayor.
Yes, Councilmember Duchin.
Thank you, Mayor, and thank you for this report. I've got a lot of questions for audit that I'll follow up, I think, independently with, just based on the report and based on the presentation. So I'm going to try and focus on a couple of things I'd like to get financial services help with. One is, just like my colleagues talked about some nuance around the bond earlier and the 6-year cycle, I'm curious about how we're thinking about nuance here in two places, for example. One is looking at the appendix and looking at who's actually spending dollars on consulting, it looks like 2 departments account for roughly 45% of all consulting spend, and 8 departments are something like 82%. So it seems like some departments are relying far more, and then some of those departments have a lot of variability year to year on how much they're spending, sometimes varying $10 million a year up or down. So I'm curious about that aspect of it, and whether there's things that we need to better understand about how certain departments are using consulting services that may need to be baked into the documentation and procurement, et cetera, things that you all are thinking about. And the second thing there is, and this is really more based on current events, which is I've been sensing there's more of a public demand around external validation for some of the work that the city does. I think about the efficiency audit that we just undertook, that we heard a lot of input that we wanted third-party consultants and external consultants engaged in that process. And so that's another related question to me, which is, where would it be more appropriate? Where could we perhaps have the capacity to do things internally from a personnel or throughput, but where might be it more appropriate for other reasons to do things externally as part of the considerations that we make for consulting? So I'll start with that question.
Excellent question. And so that's where in our management response to the first recommendation, we specifically noted that we'll collaborate with budget and organizational excellence on that capability, the capacity amongst existing city staff relative to the types of consulting services. So, because right now, I mean, these tables are very helpful, but it's aggregate spending. It doesn't necessarily dig into within those general services, within those professional services, what categories of consulting services were really being utilized, because it may be it's completely reasonable for an outside consultant to be doing that, for it to be a third party, but we want to make sure that we're digging into that in more detail, to make sure that we're not inadvertently spending dollars with consultants that we could, if we really dug a lot deeper and pushed ourselves, that we perhaps could deliver that internally, but it's going to require some greater analysis.
Okay, and I appreciate that a lot of this is a documentation issue and a procedural issue on your end. I'm also curious to the extent that currently under central procurement, we are directing all contracting under, including the consulting, including even social services consulting. Is that correct? Is all of that moving through central procurement?
Councilmember, approximately 98% of total contract spend for the city is associated with contracts under the administration of Austin Financial Services. As Director Olivares mentioned, there are some pockets of contracts that are sourced outside or administered outside of Austin Financial Services. That would include currently what we refer to as the social services contracts. They are a variety of different contracts. Some of them are contracts in the purest sense. Some of them could be categorized as consulting contracts as well. Some of them function more like grants, where the city is providing a source of funding to incent an activity provided to other recipients and not the city. So we're in the process of working with the other departments to better sort those out so that contracts are more discreetly handled and administered and monitored like contracts, and other agreements and grants can be dealt with separately and appropriately as well. We do provide guidance, and we provide system support, and we provide procedural support to these other departments that do procurement-like activities. But for the most part, that activity is overseen by Austin Financial Services, by our staff.
Got it. Okay, thank you for clarifying that.
Sure.
2 other questions before I know I need to hand this off here. First is, as you are going through this process for asking these questions and better documenting and so on, is there a need that you all have identified that you need more latitude or authority from council to make those recommended changes in terms of, that could be everything from tools or guidance or something like that. For instance, would we need to give you all more control not to release funds under certain conditions? Again, based on things that the audit has identified in terms of defining measurable deliverables or the need assessment or lack thereof, et cetera.
I think so. There's a couple of things happening behind the scenes that would contribute to this concept. So first, we're looking at doing some significant modernization of our systems that we do use for the actual solicitation process and contract development and management of those. So we're hoping to select that new system by the end of the spring. That will increase our capabilities and our capacity around just contract management and solicitations overall significantly. It will allow us also to have much better data collection, data analysis capabilities. So I think that will contribute to us being able to answer your question more fully slightly down the road. Also, we intend to come back to Audit and Finance later this year to talk about various programs such as our small and local business programs, various direction from council that impact our solicitation process overall, to be able to talk to you about what things are working, what things aren't working so well, where there might be some advantages to sunsetting and so on and so forth. So we're hoping to bring that to this committee here within the next few months. So I think as we work through those two two projects, that we'll be able to come to you later with any additional guidance or direction.
Okay, I'll look forward to that.
Yeah.
Last question is, given everything we've talked about, given the work that you're doing, do you currently feel like you've got the capabilities to make all of the necessary recommendations or implementations? Or is this a scenario where you might need to look to an external group or consultant for some help?
No, I think
Or is this an opportunity to show the rest of the departments how it's done?
the irony of this. No, I think we're in a really good spot with our existing staff. Like James and his crew are incredibly talented procurement specialists. So I have full faith in them being able to complete this effort with our existing staff and not relying on a consultant.
All right, well, I look forward to the updates. Thank you.
Thanks, Councilmember. Anything else y'all want to add? Okay. Thank you very much for the report. Thank you for the response. Members, that'll take us to item number 7. And for scheduling purposes, my goal is to have us done by noon, which means that what we're going to do is we're going to defer item number 8. We will defer item number 8 to the next meeting of the Audit and Finance Committee, but that doesn't necessarily mean we need to fill up all of the time with item number 7.